Welcome to the PACIO project, where we are doing groundbreaking work to provide a tapestry of real-time, standards-based information exchange for post-acute care. Over the next few minutes, we'll take you on a journey of what the future could look like for the care of post-acute care patients, and how this work can open up a world of new opportunities for innovation in the future. 45% of Medicare patients that leave the hospital go into some form of post-acute care, so it is a huge part of our healthcare system. Post-acute care patients can be very complex with many stops along their healthcare journey, so it is vital that their health information travel with them. Unfortunately, that is typically not the case today. Communication is often poor across care providers, which can lead to adverse outcomes. There is a heavy reliance on patient recall during periods of high stress, which can be unreliable. Patients may also be unable to communicate necessary information, which adds burden to providers who must then track down that missing information. The PACIO project was created in February 2019 to help address these issues and includes a great experienced community of several dozen participants, including vendors, government agencies, clinical consortiums, clinicians, and contractors. These participants bring many different perspectives and skills to the table, and PACIO would not be able to develop these standards without them. The PACIO project works on several different use cases. We work on functional status, cognitive status, and SPLASH, which is speech, language, swallowing, cognitive communication, and hearing. Those are all included and packaged together under a FHIR implementation guide called Personal Functioning and Engagement. In addition, we are working on developing FHIR exchange standards for advanced directives and reassessment time points. Reassessment time points break long-term encounters into smaller chunks. Long-term encounters can last several months or even years, and reassessment time points help to further organize that information. Finally, we take a lot of this data and apply them to quality measures, and we actively work with other groups to see if they can calculate quality measures from our data. I would like to introduce you to Ms. Betsy Smith-Johnson, a fictional patient who demonstrates how gaps in health information, lack of standards, and miscommunication can be solved. Her story illustrates how individuals and caregivers can be active participants in their healthcare by ensuring the right information is available when and where it is needed. Our 5-scene scenario begins in scene 1 with Betsy at home, where her care plan is created and entered by her care coordinator using software from FEI Systems to capture her goals, like dancing at her son's upcoming wedding, transportation needs, and what other information she might need. That care plan is sent to Patient-Centric Solutions Health Data Manager, a central repository for Betsy's health information that can later be accessed through Alterum software or by Betsy herself using Patient-Centric Solutions Patient Share application. Betsy's advanced directive information is also captured and stored using AD Vault software, such as her living will, which can be retrieved later by other facilities as well as Betsy through the MaxMD mobile application on her phone. Patient-Centric Solutions Health Data Manager also pulls in data from the Michigan Health Information Network so that information about Betsy's demographics, conditions, medications, lab results, and immunizations are available. In scene 2, Betsy falls after suffering a stroke and goes to the hospital. The hospital is able to access her care plan and advanced directive information through their EHR software, so they are informed about Betsy's history. The hospital uses a PAC assessment application that retrieves standardized assessments from the CMS data element library, populates the form for that assessment, and collects the information from the clinician. That data is then sent to the EHR system and the Health Data Manager. Thankfully, Betsy's condition improves in scene 3, and she is discharged to a skilled nursing facility. The skilled nursing facility can retrieve the assessments done at the hospital, including her care plan and advance directives, and perform new assessments, which are sent to the Health Data Manager and CMS. Betsy continues to improve and is discharged back home under home health agency care, which is also able to pull up, using patient-centric solutions software, all of the assessments done at the hospital and at the skilled nursing facility, her health care plan, and advance directives so they can provide her the best care. The skilled nursing facility performs additional assessments and fills out the necessary forms using the Matrix Care EHR software, which retrieves the assessment from the CMS data element library and displays the form for the clinician to complete. Once complete, it sends the assessment to the Health Data Manager and CMS for collection and analysis. All along the way, in Scene 5, Betsy and her caregivers can use the Patient Share application from Patient-Centric Solutions to access all of the information collected, including conditions, care plan, medications, assessments, and her progress. Betsy can also provide consent to her son, Charles Johnson, who can log in separately through ID.me identity management software to access his mother's information and monitor her progress. This demonstration shows how multiple information sources can be integrated together across 16 systems in real time to provide patient-centered care, not provider or system-centered care. It provides an up-to-the-minute, fully informed, patient-centered personalized care plan to bring together the individual patient, their caregivers, and the care team. Information can be gathered more completely and shared to provide responses quickly at the point of care. The patient is more engaged and can see and validate their own data. A feedback loop can also be built for continuous improvement, where performance can be measured, analyzed, drive clinical research, which can inform new healthcare policy and clinical decision support, improving delivery of care not only at the facility level, but most importantly, at the patient level. This work provides several improvements over what is being done today, since information is exchanged in real time. The care provider doesn't have to wait to receive the information. The data follows the patient, is available at the point of care when needed, and standardized and exchanged using the CMS data element library and HL7 FHIR standards. This reduces burden on both the patient and provider and can prevent expensive and unnecessary duplicate procedures. It is patient-centered, so the patient and their caregivers are informed and more engaged. It allows CMS and others to perform data analysis across populations with clinical data, supports the future of digital quality measures, and enables syndromic surveillance in real time across large populations. The time is now. With support from CMS, the PACIO project is creating digital architectures that enable the sharing of structured, computable, post-acute care data across the healthcare industry, focusing on patient-centered care and uniting the payment and quality industry to provide continuous improvement in patient care. Please consider joining this important work, and thanks again for watching.